This is by far the best experience of dealing with this crisis that there is.
The considerations you need to have to effectively control a pandemic are here.
Playing this game will show people who have been wondering how would it actually be if I was in charge.
Matt managed to pull it back. I thought he was going to lose for a bit there.
That was a close call for a touch, but yeah.
There are a lot of really good concepts that you get to play with.
I really hope that people try it out and see what it's like to be a one-person response. So my name is Javier Elkin, and I am part of the Digital Health and Innovation Department at WHO.
And hi, I'm Paul Leffler. I'm a public health physician and on the steering committee for the Global Outbreak Alert and Response Network, which has its secretariat at the World Health Organization.
Okay, we're going to start our operation in a travel hub, so I'm going to pick Egypt today.
Yeah, that's good. Easy to get around.
So since we're playing against virus, we can't actually see where it is, so we're going to need to have to set out some field operatives and some investigation teams to see what we can find.
Yeah.
Early in my career, I was part of the Epidemic Intelligence Service at the Centers for Disease Control. Was able to get some international experience in different environments, exploring outbreaks.
We really wanted to kind of capture that feeling of how people are going around trying to understand where different outbreaks are coming from.
Well, essentially, most countries of the world have some mechanisms in place to identify unusual events, and it almost always comes down to the astute clinician that recognizes something's going on. And then that'll get escalated to the national government, and then if it's a big issue, we'll often go to international organizations like the World Health Organization and sometimes the CDC in Atlanta.
So we've now just found the virus, so we can start with having some public awareness or hand washing. Is there any preference for you guys?
Hand washing is always good. I'm a big believer in infection control practices, since they seem to be faulty ones seem to be at the heart of many of the emerging infectious diseases we've seen lately in the world.
Oh, in that case, we'll grab both of them, get some hand washing and some public awareness, make sure everyone knows exactly what it needs to do.
Absolutely. It's also because it's a new virus and it's not all over the world yet. It's going to be very hard convincing people that it's something to worry about at this stage.
Exactly. Yeah. I think we actually even have it here in our operation tab. We have a technology here that allows us to really emphasize that this virus is in fact something that's worth taking seriously and not a novel one.
Probably something important to do since we have this, prior knowledge that it is serious.
Let's do that straight away. Scrap that and we'll get some.
We saw that in West Africa with the Ebola outbreak, since it showed up in new countries. There was a misinformation early on, and it's really important to give the public accurate, credible information when you're trying to control a new disease threat.
How many diseases get reported by these kind of systems, but they actually end up not being that big a deal? I mean, obviously we've seen with COVID, one came out of nowhere that has been a huge deal, but how many kind of get through those reporting networks and then actually sort of just, no, we don't need to worry about them too much?
There's quite a few signals that come up, and that's what you want. You want a very sensitive net that brings potential signals to the surface. And then a lot of times they'll rule out and be nothing or be something commonplace that doesn't result in more cases. But then occasionally you have the ones that really take off, as you said with COVID, and certainly Ebola in West Africa in 2014 when it started. We didn't foresee how big an outbreak that would be.
And here I see we're able to very quickly, with one click of a button, send disease investigation teams to different countries, which is really fantastic. If only it worked that way in real life, where you could just send disease investigation teams easily into any country as soon as there's a first few cases reported.
If only it was so easy.
I mean, sometimes I think we sort of forget that the countries are sovereign nations, and they decide when they want help and who they want to help. So it's always important to respect that.
So when I see that the virus has spread quite a bit, are we start taking some measures that are maybe a bit more serious, considering border controls and things like that, or contact tracing?
We can, exactly, yeah. If we jump to our response tab, we can start setting up contact tracing. So we'll get that underway now and hopefully get the disease under wraps in sort of smaller populations.
And maybe mask wearing as well, if we could get to that one.
Yeah, we can start with our PP package one.
At these early stages, Sumi, our chief scientist, just recently went on BBC Hard Talk and also said that at the earliest stages of a virus spreading, masks will have actually a much more significant effect in controlling the virus spread than a vaccine at this stage, for example, right? So because the vaccine takes a long time to develop.
It does, but speaking of that, we should probably get our vaccine underway.
I'm going to say I think maybe we need to focus on good treatment early on. That's one of the first things in an outbreak is you want to make sure that you're taking good care of the people that got sick, because that's where you lose credibility of the population early. And if you want people to present for care, they have to be inclined to believe that they're going to get good care, potentially life-saving care. So I'd make sure that's part. While I don't disagree with the other measures that have been proposed, I think early on is to try and get optimal care for those that are sick.
And also adding on that, I think since the vaccine research is already available, we could probably start just knowing how the game works as well. We should probably start researching it's going to have the greatest impact in reversal.
Let's get that underway now then.
Well, I would say not even knowing how the game works. I guess this most recent experience with COVID-19 has really showed how incredibly important it was to start vaccine research early and to hedge bets and go with lots of candidates and not hold back on resources, because it's really phenomenal that we have a vaccine this quickly in this outbreak. And I wouldn't believe it was possible if the game said that was true, but now we have real world experience that demonstrates it. And
so I definitely think if we can start, maybe, I mean, all the cases seem to be very concentrated in that. Well, as I was speaking.
Not anymore.
Well, not anymore.
Oh dear.
Yes. All right. So maybe we should be doing some damage control, perhaps. Our authority is quite high, I see. So we could probably start taking in some quarantine measures.
Exactly. Yeah. We'll jump into the quarantine screen here, and we'll start using some bit more stronger measures. We'll start closing down the airports, most likely.
Yeah.
So Javier, what are some of the downsides of quarantine measures in your experience?
Well, quarantine measures will start creating this sense of sometimes blame and also sometimes separation between different regions, between countries. It starts creating this very complex dynamics from a global perspective, because some countries have basically the ability to do more than others, right? I mean, you can go party in one country, but you can't in another. You can go to the restaurant, 100 kilometers from your house, but not just outside of your house. So there's some complications there. But then also, of course, there's a lot of social and economic and psychological impact on actually closing down countries and businesses, and then we've seen, for example, during the COVID pandemic, what different countries will consider essential businesses, right? And some people say, well, there are some things that are essential to my livelihood, and how can you not consider that? So it's a very, very complex decision process. However, and also we also know that it will be, as Dr. Tedros has been saying throughout the whole pandemic, that quarantines and lockdowns and these kind of constrictions of traveling will be affecting the poorest of the poor the most, and those most vulnerable will be affected most. There are many people who live on a daily basis, on a daily income basis, and those people will be affected the most by these measures.
Yeah, so I absolutely agree that there's complicated economic impacts that can be really detrimental to health in the long term. But I'd also say on a simpler sense, it can sometimes drive cases underground. If they realize that they're going to be isolated, maybe against their will, and that their family and friends are going to be quarantined and other things, you can start to lose the trust of the population if they don't understand why it's necessary.
Exactly. Yeah, we're seeing a lot of that in the game right now, actually, where we need to roll out some stronger economic support to carry everyone through these extreme quarantine measures we're using.
Absolutely. And if we could maybe speed up that vaccine research. Get an international collaboration going on the bottom left.
Yeah, we can get some accelerated research here. Grab that.
And maybe I don't know. Yeah, go ahead.
Very often you can have a situation where maybe it's a zoonotic infection, meaning it's come from chickens in the case of avian flu, or in other instances pigs for Nipah virus. And it's really important to make sure that the farmers, who often have to sacrifice their herds, their flocks, in order to do the greater good for the community, have that, are willing to do it if they don't suffer too badly economically. So having that economic support is important, and we've seen that here with COVID and the pandemic as well.
And I see here at the bottom we have these really amazing data coming through, right? We can see that we actually have, we know the exact cases. They change almost on a second by second basis for every single country. And if only we had that level of accuracy and transparency from every country, it might actually make the situation manageable at this level, right? However, in reality, it's very difficult, because every country has, again, the ability to count a specific death from, for example, here virus in its own way, and so they may actually choose what counts as a case, what counts as a death from this virus in a different way from a neighboring country, and that will actually make the data less accurate and less transparent.
I saw you just fund some PPE, and I was going to ask about that, how we're doing on infection control, because in many outbreaks, as I mentioned earlier, like MERS or Ebola, Nipah, the healthcare system can actually be an amplifier if there aren't rigorous infection control practices in place and the proper equipment. Even in many places, that's hard to come by. And when that happens again, people are disinclined to seek care if they realize that the healthcare system itself might be the amplifier. And then once you start losing healthcare workers to the disease, as we saw in SARS and other things, the first SARS, it becomes more complicated to provide the care you need. Over.
So considering our authority is quite high, I still see it over 100. We might, which it's a measure of kind of how well is the world going to comply with whatever we say. And we have quite a bit of resources. We could start also doing some more debt relief where needed, and also perhaps more lockdowns where the countries where we see the highest number of cases, to limit further spread.
Yeah, definitely. We'll start putting some heavy restrictions onto Europe and Africa. Okay, and we'll jump over here to Operation Tab, and we'll get the highest tier we can, a national stimulus to carry everyone through.
And so what's the bottom left one that looks like the WHO logo?
Oh, this one here increases our authority. So it allows people to respect us a bit more and keeps us going.
We're doing okay for now. We're doing okay.
We are doing okay.
And how's the vaccine research going? That's where it's 60% almost. Should we start considering maybe the deployment and manufacturing capabilities as well at this stage?
Yeah, exactly. So we are at 60% of our vaccine research now. And one of the key points we actually wanted to touch on was starting manufacturing early. So if you want, we can start that right now, and hopefully we'll be a bit better prepared later on.
Yes, absolutely. I think this would be great at this stage. Even though it may seem early, but in reality, as we've seen even now, we had the vaccine, months ago, but then it took time to go through the regulatory processes that are very important, and also to supply it to all the countries in enough doses. And so that required a lot more preparation, obviously. And in this case, we're always rushing for time, so it's better to start early.
So when's the best time to start research on these things? Before they happen, I would say. And we're fortunate. You can't do everything before it happens because you don't know the virus and the genetic code. But we're fortunate that work was already ongoing with the chimp adenovirus vaccine before we needed it for COVID, as one example. And also with the mRNA vaccines, they were already in development for Nipah virus candidates, and they were able to transition them over. So, I would submit that the time to do research at combating pandemics and emerging infectious diseases is before they pop up.
Absolutely, and that's true for preparedness in general, for in public health, and we'll always see that the countries, for example, even in COVID-19, the countries who had experienced the earlier cultural shifts due to SARS or other virus outbreaks, especially in the Southeast Asian countries, then we've seen how they responded much faster with mask wearing, less resistance, and more appropriate measures without requiring all the time hard government intervention and enforcing policies onto their populations. And they were able to control the viruses in many places in that way. And so that's something that we can definitely learn from, that preparation across the board will always be good bang for the buck. Basically, you get a really good return on investment when you spend in public health and create all these measures early on.
Do you think that the lessons learned from COVID-19 will persist long term, or do you think that once it's all finally sorted, everyone's going to stop caring about it again?
Well, I personally think there's some big hard lessons that we've had to learn from COVID that are going to last for a long time. We as humans, we certainly do forget, because essentially when I went to medical school, we weren't even taught about the 1918 influenza pandemic because it was so far away, and yet it killed on an order that makes even greater than COVID. But I think these lessons are going to be around for quite some time, and I think it's our job. And one of the reasons GOARN was interested in helping to contribute to the cure is to make sure that a younger generation of people are aware of what it takes to combat a pandemic and have some realism and some interest in it, so that we can keep these lessons alive going forward.
Yeah, definitely. I think that it's demonstrated to the world the complexity behind tackling public health crises, but also the importance of what really being connected to each other means. We've seen at an unprecedented level how our lives have been disrupted by this virus, and so definitely I think there will be at least a generational shift in the considerations, hopefully to the same level as the climate change awareness that there is today amongst the younger generations, and this will last beyond this pandemic.
Releasing down there, released. Okay, we released.
Yes, we actually got our vaccine out of the door already.
So we have a lot of resources. Let's spend those on vaccine-related stuff at this stage.
Let's start spending.
Let's start spending that money. We don't want to sit on funds if people need them.
No, we've already eradicated the entire virus.
Great, success.
So that one was all dealt with in a single year, which was. Were you playing on easy mode there, Matt?
We were playing on casual that mode, yes.
Matt, go on, knock out the difficulty one. We've got the experts with us.
You got to name this one, Javier.
Sorry?
Who's going to pick the name this time, then?
You got to come up with the name.
The Parasite?
People all over the world are going to judge you based on the name.
No pressure. Right.
So don't choke.
Poxies, Poxies.
Sounds terrifying.
Okay, Poxies, we'll go with that.
So a difference in this game mode is that we now put in the requirement to analyze the disease. So as soon as you discovered it, you could immediately know all the correct things to do on it. But this time, we're going to have to take some time first to understand it better before we can work out appropriate action. So initially, we'll have to just use very blunt quarantine measures to deal with it.
All right. So, yeah, just upgrading the basic.
Yeah, we're going to get our teams rolling out and seeing if we can find this as quick as we can.
How long does it typically take to kind of start building up an understanding of a disease and fully nailing down all its symptoms and stuff? I guess we're still seeing it happen with COVID, aren't we, even now?
Yeah, I would say that in previous times it took quite a while to figure out what was going on. But you'd have to argue that the COVID response, even though we are learning more, the fact that they were able to identify it and sequence it and have that sequence available for test kits and for treatments and for vaccines, in a very short time, I think that the genetic angle represents a new world for us in figuring out what's going on with pathogens. I would say when I was beginning my career, when I first started med school, HIV had not even been described, but the cases were occurring and we didn't know it. And it wasn't until several years that we had a reliable test where we could actually test people. For a long time, we didn't even know how it was being transmitted for sure. I don't think that would happen in the modern world. Diseases always surprise you.
Yeah. Javier, earlier on you said how wearing a mask is incredibly important for controlling sort of viruses and stuff. I guess, why do you think we did it at the right time with COVID-19, or in retrospect, should we have started sort of advising mask wearing earlier?
I think you'll have seen that as in those countries that had been affected by a similar virus, by SARS, for example, in the past, they adopted mask wearing almost immediately. But not only that, they have a different culture and approach towards mask wearing. So that basically, if you're unwell, it's accepted to go around, public transportation with a mask. It's accepted to go into the office with a mask. If you're not feeling 100%, it's almost polite to do so. And with many of the colleagues working in public health, this is something that we see, that there's this adoption of this different cultural practice of wearing a mask is not this disruptive or limitation. It's not a limitation in your daily life. It's more a consideration toward others. And I remember when I was traveling around, we always see many travelers from all over the world, and in particular those coming from Asian countries will sometimes wear masks even though they're in large groups, and it's because of this cultural difference that they have, right? In many countries there, toward the awareness of you can always catch something if you're in a large group, if you're walking like that. And it's not because there's a pandemic that you should be wearing a mask. You should just sometimes do it as just good practice. Just like you wear a helmet when you ride your motorcycle or put a seatbelt on when you drive a car, there's certain situations where you can take some safety measures that are very easy, low cost, and will protect you.
I just want to add that, the mask wearing is appropriate certainly for coronaviruses, but it wouldn't have made a difference in many situations for HIV, which is probably one of the biggest pandemics we've seen worldwide recently, and wouldn't play a role in Ebola control either. So as you're suggesting here, you really got to know your pathogen to pick your control measures, and certainly for coronaviruses, mask wearing works.
Right, and that's why probably in the game we should. I don't know how the analysis of the current Parasite is going, but I guess that will also tell us what sort of transmission it
just
is.
It just got analyzed 100%. I see.
Yes, we just managed to analyze that already.
And so this will also tell us, I hope, whether it's transmissible by air, and therefore
exactly. We can jump into our control hub actually and have a look at the traits that the Parasite has. So you can see here that the parasite eggs in water cause significant outbreaks in poor regions. So we need to make sure we kind of keep those regions a lot more protected from the parasite.
So what we've seen with COVID is certainly wealthy countries can be affected as much as any country. But within those countries, it's often people that are economically or socially disenfranchised that bear the brunt of the outbreaks. So I think it's really important that when we address these potential pandemics, that we always keep that in mind. Who are the disenfranchised populations that might suffer the most impact?
And so, considering that we've seen that the parasites will more likely be affecting poorer countries as it's transmissible by water, and that's where the plumbing and sanitation systems and all of that is going to be very important. I don't know if we can start some education campaigns anyways to inform people about this, if there is that possibility.
So what we can do here, if I just managed to grab that a second ago, is grab Medical Aid 1. So this will help us kind of reduce the extra infection rate in poorer regions by giving them some extra support where they need it.
Great.
Fantastic.
So we did have to use lockdowns quite early on while we were analysing that disease, and we didn't know quite how to stop it. So we do have a lot of non-compliance brewing in Africa. Ooh, the extreme spread.
Have you guys ever seen the movie? Outbreak with Dustin Hoffman?
I have, yes.
This game kind of moves at that same speed, where things happen pretty quickly.
The difference.
I think they're the
reality, I guess.
So yeah, I'm monitoring, but and also I can see there's a water tap down there. I don't know what that is, but it probably sounds like it's relevant measure to be taking.
Yeah, we can get some clinical treatments going and help reduce the fatality rate.
Yeah, probably need some of those, and then also, yes, if this is getting ugly. Also the TV, right? That's the information campaign, I imagine.
Yeah, we need to start some public awareness. We'll grab that too.
And if it's a parasite, we might be able to actually treat them. If it's something we may have to be able to repurpose some existing treatment for, or do some of that. But
yeah, we can try some treatment efficiencies, see what we can use.
So is this parasite going person to person, or is it only through water or environmental?
This will be both through water and environmental. And people, sorry.
Because obviously diseases that are limited to going through, consuming them or environmental situations are usually a little bit easier to control because they require that physical environment to be conducive to spread. Having said that, you can think of cholera, which basically you drink it or you ingest it, more often drink it, and it can be explosive in its scope very quickly.
So maybe we should enable contact tracing as well. I don't know if we have already.
No, we don't have contact tracing yet.
Yeah, and are we? What about testing? Yeah, testing is important as well.
Yeah, we'll expand our testing capacity, get as many people checked out as we can, see if we can improve the general use of it as well.
So again, was this a disease that spread person to person? Because I probably wouldn't do contact tracing if it's not.
So in this one here in Plague Inc., this will spread person to person and through the environment, so we need to tackle both at once.
Okay, you've made a tough customer there.
I think I might start to improve our vaccine research speed as well. We need to definitely get this underway.
And if we can, then do some screening. I don't know if we're doing airport screening, those sort of things, because I see it's kind of happening all over the world now.
It is, yeah. We've got some airport screening set up. We could do boats. Should we do port screening?
Yeah.
Let's get that then.
So, having boasted about how good medicine is and how quickly it works in the modern era, I have to think back to malaria, which is a parasite which we've been woefully inadequate in being able to address worldwide, really. So there are still these things that we struggle with, and parasites can be particularly problematic because of their ability to be maintained in the environment.
Do you think malaria is going to benefit from the COVID-19 research, or is it actually just going to be hit because of the distraction effectively from controlling it because of COVID?
Well, my gut feeling is it won't directly benefit from the COVID-19 research, and it's more likely in the short term at least, it'll be negatively impacted from the resources that get diverted away. And I think if there's a chance we're going to make countries with struggling economies struggle more and the individuals struggle more, there's always the negative health impacts, including maybe not getting tested and treated for malaria. So I don't think in the short term it's likely to be beneficial, but I do hope this sort of world's awakening to the fact that pandemics can happen in our lifetime might bring more interest in medical research, and also actually universal access to healthcare. I think that we've seen that that's a pretty important factor in trying to control pandemic, and that would include obviously the ability to address endemic parasites. So picking up on a comment that Javier made earlier, the way I've heard some of the things I think you were saying expressed is that societies that really place a high value on the collective well-being of the community, as maybe opposed to those that really value an individual's independence and right to do whatever they want as a primary right tended to do better in the COVID pandemic. And I kind of think that when I look at some of the ways that it's played out in different countries, that really what you're talking about, the fact that you will inconvenience yourself to wear a mask for the community benefit is I think played out in some countries as being beneficial. That in other approaches versus we've seen in some countries that really pride themselves on an individual's rights and independence have done much less well. I'll put it that way.
I think that's an interesting take on it. I think you could also argue the difference, which is that if you value individual liberties and you've seen what happens to a country that needs to manage a very, very difficult epidemic, then you're better off making sure that you control things as much as you can, and everyone else does too, for the sake of being able to maintain those freedoms. Even if you're doing it from a purely kind of individualistic point of view and not considering kind of the greater good, you know that you can't deny living in a society, and that governments will have to eventually take a position of some kind to take measures and impose measures in order to move this forward. Yeah, I don't know. I think you could see it both ways.
How long do you think it will be until you can kind of assess one country's response to another one? Because over the course of it, you've had countries seem to do well and then suddenly not do so well. Like when's there going to be a final scorecard of country responses that let us work out the correct way to do it?
That's an interesting question. I think it's going to be some time. Two thoughts that come to mind there as we saw the intense scrutiny that Sweden got in this COVID-19 pandemic. And yet I think we need the benefit of hindsight to really assess what the impact of some of those decisions were and whether the scrutiny they received was justified going forward. But what is interesting to me is that the two countries that were rated number 1 and 2 in their preparedness for pandemic and public health emergencies were the United States and the United Kingdom. And I think this experience with COVID should cause us to go reassess how we measure preparedness, and even if we have objectively high levels of resources and preparedness, how those might not come into play when they're needed based on the political context or other concerns that might be going on.
Now that you guys have seen some of what's going on in Plague Inc., what kind of a key differences that you're noticing in the game compared to in the real world?
Want to go first, Javier?
Sure, I have a few, but I'm very curious about yours too. So I think the first one is this kind of what I call God mode. I think it's as a gamer, that's when you kind of enable all and you have all the cheats and you can do everything and anything. And this is sort of what this game allows you to do. You have this beautiful overview. Even here, you have all the country states. You can see which ones are in good health, which ones have that radioactive signal, which ones have the little hearts, right? Recovered, I guess that is, yeah. And you have all this great data. You have this wonderful data coming from all over the world in real time and providing you what's happening on a country by country basis, on a regional basis, on a global basis. You know where planes are going, where you know everything about everything. And I think that one shows that it's actually the complexity of dealing with these sort of things is very, very high, but it's also in the real world, you don't have access to all of that. And what you do have is very, very different from reality. So here we are seeing reality. We don't have, maybe in higher difficulties, you actually don't know what's going on and you don't have accurate information, which would make the game a lot harder and more realistic. But in this version, it feels like we have accurate information for everything. and you know exactly what's going on. So I think that's one key thing. And the other thing is I actually appreciate the complexity of this game, because it shows that when you're working in public health, you're actually looking at transport, you're looking at economic relief, you're looking at political decisions. Your main tools, as this shows within I think it's the response tab as well, is we have multilateral cooperation between countries, between agencies, right? Which is why the UN was set up to deal with these sort of situations. But in the response tab, at the end of the day, our tools are mostly really good arguments to try to convince others to do things, or being able to actually do things in the area of public health. And those are actually much harder than pressing a button. And I think the timelines are much faster here in the game. I think everything happens much faster, and that's important. Otherwise, it'd be very boring if it took a year to do one game. I could imagine even that would be probably too fast, right? But I think those are some key differences, and also something good.
But how I would frame it up is, I think in the Cure, there are a lot of really good concepts that you get to examine and play with, really, for their impact and become aware of and introduced to. But I think we should think of it as concepts, and that the real world is so much more complex, as was just being stated. We haven't even brought in civil wars, and maybe more than civil wars, and how that impacts ability to control diseases, because it's very trying in those situations. But again, GOARN's interest in helping develop the game, it was really to make these concepts available to a new generation, or a new way of learning. Where gaming is really good at helping people make decisions and assess facts and other things, and introducing concepts. And we see a value of trying these new technologies to reach different audiences. And I think it serves that purpose as far as introducing a wide array of the strategies you would use to control various disease outbreaks. So in that sense, the concepts are robust.
So I guess the key messages you would like players to take away from this is what exactly? If people are going to take away one message from it, what do you want to say?
I'll frame the negative first. I'll say, although the game does not necessarily represent exactly how things play out in reality, because there needs to be some simplification, the broad scope of concepts of how the considerations you need to have to effectively control a pandemic are here, and people will get exposed to them through playing the game, and start them thinking, and hopefully that's on the beginning of a further journey with more rigorous study and experience to get involved in outbreak control. It can be a pretty exciting field, although I won't say it's not stressful at times.
And I think kind of like in one sentence, I'd say it's harder than you think it is, because throughout this whole pandemic, I've had a lot of discussions with my friends and family about why certain countries are taking certain decisions, why aren't they all doing the same thing, why are certain guidelines not necessarily being followed or listened to or acted upon if clear guidance is given, and things like that. And I think it's just playing this game will, one, show people who have been wondering, like, how would it actually be to if I was in charge type of scenario, because everyone thinks that they can do this sometimes. And then it shows them it's actually much harder than you think, and the variables to consider are much harder and much more complex than what we could show in a game. But it also, I think the first time you play this, it even for me, and I'm a seasoned gamer, and playing this the first time, even on casual difficulty, for me, it was difficult because there were so many elements to consider, so many things to take into account. And what I found realistic was that in my case, the bacteria, the virus, it didn't care about you. It just did its thing. And it kept going, and it kept infecting and killing, and you're there trying to figure out all the things going on in the background, and it's just not going to happen in time. And there's always going to be difficult decisions to make.
So I'll pick up on some thoughts we just released the vaccine. That's an example of, here you can have the COVID-19 vaccine rollout. You can have what by all the available information is a very effective vaccines and safe vaccines. As we accumulate real world data, you'll still have individuals that are not inclined to be vaccinated, don't see it in their interest for a variety of reasons. And I would put that sort of in the basket of, when you're dealing with outbreaks, when you have science interacts with culture or is in conflict with culture culture almost always wins, and that and the culture changes slowly, and people's beliefs take time to evolve. So even if we have good tools in the toolbox, it may be more difficult than we imagine to implement them.
And we're actually wanting in the future to explore some of the kind of the what comes next from a vaccine hesitancy point of view. That's something as a studio we think would be quite interesting to take a look at going forwards. Well, Matt managed to pull it back. I thought he was going to lose for a bit there.
That was a close call for a touch.
So did I, but that vaccine came out and it just walloped it, huh?
Well, I guess before we wrap things up, is there anything else that either of you wanted to mention or point out?
I think it's you've created the most advanced and realistic simulation of reality in this case. You know, it's not, of course, it's not perfect, and we had all those caveats, but this is by far the best experience of dealing with this crisis that there is. And I really hope that people try it out and see what it's like to be sometimes, this one person response to a world crisis, because I think it would increase at least I hope the sensitivity toward these issues, and to in a bit more, and maybe create a bit more empathy with the difficulties of making decisions, and that it doesn't matter if you're an experienced doctor like Paul, who's been working all his life in this area. It's very, very difficult to actually make change happen, even if you have all the facts at hand, because there's so much going on, there's so much complexity and political considerations for everything. One of the best parts of this game is that we can actually reach people who may not have interacted extensively with this pandemic, from a news point of view, maybe, or if you're a gamer, maybe you've been, usually you're of a younger audience, and maybe you're just concerned because you're not able to go to school, and you're just hanging out with your friends online, or maybe you're playing video games online, as many teenagers are, right? And I think that with this game, we're giving them an opportunity to really get in our shoes, and the WHO really wants to reach the younger audience and get them to interact with the work that we do on a daily basis, wherever they are, from their mobile phone, while on the bus, while they're playing their games. They can all of a sudden, oh look, I can get in the shoes of someone at WHO, of someone at the Ministry of Health, of someone in a public health NGO working at trying to help the world in this way and address the public health emergencies. And so this is a very, very helpful tool, and it's important for WHO to reach people where they already are, because you can have the maximum impact in their lives by showing that this is part of their life, that this is part of their everyday.
GOARN was really interested in trying to work on the development of the cure, because we saw it as an opportunity to reach new audiences with the concepts and of what it takes to control a pandemic and implement effective control measures. And while the game is necessarily a simplification of those, it does give people an opportunity to become at least aware of the different approaches one might use and the complexity involved. And so we hope it's an opportunity for people that aren't as involved in this to at least perhaps strike an interest in it and maybe ultimately consider a career going forward.
It's important to also make sure that people know that there's so much that they can do to help end the pandemic, even right now, that beyond playing this game to better understand and learn what's happening and how different measures have an impact on the world, it's also at a very individual level. You can wash your hands, you can wear a mask, keep your distance. There's all sorts of things that you can do, cough in your elbow. There are many small things that added up. It's like it'll have the biggest impact. And we can really make a difference in the world by taking these actions individually. And you can find out more at the link below.
Cool. Well, I mean, thanks so much, Paul and Javier, for joining us. Like, it's been, well, thanks for your help early on when we were creating it, but also, like, it's just really fascinating hearing what people who are dealing with this stuff in the real world think about it and the things that we learn from it. So really appreciate you taking the time.
All right. Thank you very much.
Thanks for having us. Appreciate it.